80% of musculoskeletal pain originates with problems with the viscera. And I was just thinking to myself, come on, man, if this guy is really truly correct, where 80% is coming from the viscera, that means I'm only having a 20% effectiveness rate with working with my clients if I'm not addressing the viscera.
Hey guys, welcome back to another episode of Brotherhood Beyond Business podcast. I'm here with Justin McKinney of McKinney Physical Therapy. We're going to walk through his life, understand his business, and kind of see what his legacy is like here in the Prescott area. Justin, you can go ahead and tell me a little bit about yourself, why you're in the Prescott area, and talk about your business too.
Sure. Yeah. So when I was preparing for this, looking at all the factors that led me to land in Prescott, it was pretty amazing. My wife and I are pretty much out of the box people. We have a different lifestyle and how our careers developed from the typical normal, and it's the story of why Prescott is what we call home now. And the journey started off. We were out of school. We worked at a hospital outpatient physical therapy clinic, and we started noticing some frustration there, about the system in place, and how, as a physical therapist, you're trained in the musculoskeletal model, and you see things in musculoskeletal lenses. So, for example, a physical therapist, if you ask them, okay, what do you see when you look at this body? They'll say, well, muscles, tendons, ligaments, joints, bones, and that's about it. So, we started to feel the frustrations at our first job. And then we started for the next 13 years traveling all around the country. And in that time, we also got to work and do overseas, like medical mission work. And we kept seeing these same flaws of the musculoskeletal system. And you could get somebody better, and maybe it would be, in your opinion, like 50% better. Like, oh yeah, I'm having half the amount of back pain that I was previously. But, and then there was always the but. And you're kind of thinking to yourself, okay, there's something wrong with this, right? There's just got to be something more. And the whole time that you're feeling this and you're kind of seeing this, you also see how the systems are set up in place, like the healthcare systems, to reinforce the musculoskeletal model. So, for example, what is valuable in a healthcare system, that you see a lot of people, right? So, it's not that you get superb results. It's that you made the company money. You're efficient. You see a high amount of clients in a short amount of time. So, seeing all that happen, it just just really kind of just rubbed us, and we knew there was something wrong. And in the process of being all over the country, and and different places in the world, you started to see these outliers, right? So these weird practitioners. I remember one time we were walking through a clinic for orientation in Oregon, and they're like, okay, this is where, our practitioners practice. And you saw these toilet plungers, and you're like, what's going on with the toilet plungers? And they're like, oh, that's for myofascial release. And you're like, what? Oh yeah, they'll toilet plungers on clients. And some of the practitioners like had decorated the handles of the toilet plungers and painted it, and it made it really pretty. And you're like, this is so odd, and then, someplace else, I met a guy, and, it was just like, this is this weirdo guy. And like, why is this guy so weird? And he's like, oh, because he does this crazy thing called craniosacral. And, like all the clients wanted to see this guy, and there was something different about him. And he was just had a different approach. And you're sitting down, and you're just like, man, what are you doing? What are you doing? And he's just like, wow, I'm doing craniosacral. What's that all about? And oh, that's, where you're, moving the central nervous system. And you're just like, what is going on? And it started to just really just rock your world. And you're like, wait a second, there's more to the body than musculoskeletal. And at each stage is as we're kind of developing our careers, and working hard, and developing just just a really highly skilled manual skill set. So that's one thing I really started to just trend towards, is just working with my hands, really putting my hands on a client and doing a good job. So I was working on getting my manual certification, and the manual certification is of the osteopathic pathway, which is, joint manipulations, muscle energy, myofascial release, all those things that you look at and you say, okay, if I went to a DO, an osteopathic, clinic, whatever, so these are the things that I'm building my skill set, my repertoire with. But these outlier people are like, okay, there's something going on. There's something going on. There's something going on. And at the heart of everything is, you want to do the best that you can do for a client, right? You don't want to sell them short. You don't want to get them 50% better. You want to get them 100% better. And you're just like, okay, I have to learn these other things. So as you start to talk to these people, they start making you look outside of the musculoskeletal lens, and you're just like, central nervous system, what's that all about? Let's explore that, and the cool part is, on my journey, like, people were just very willing to share their knowledge base with me, like, I'll show you how to do that, and there was times where we were just doing just some really crazy outlandish treatments at the time, uh, but it just really expanded my viewpoint of the human body. And what we started realizing is, okay, not only is the musculoskeletal lens coming up short, but the whole model of, you know, see patients, put them out, like, we kind of make jokes in the physical therapy community. We call them patient mills, right? So, or high priced gym memberships. You get a bunch of, gym equipment, and you put a bunch of clients on there, and you charge them, and, off they go. And everybody kind of gets through the whole routine. And we're saying in our, my wife and I are just like, this isn't really fostering the things that we want. And what the things we want is, we want to really explore these other avenues of treatment. We want to look at all these ways of looking at the body. And that's kind of where, Prescott started coming in. So there's a practitioner in town. Her name's Ruth Backway, and she started Backway's Physical Therapy. And Backway's Physical Therapy, the whole concept was just radically different at the time. Like, you know, maybe nowadays it's not that different, but at the time there was nothing like it. And it was a collection of independent contractors, right? So you go to this clinic, and as a practitioner, and the front office staff is there to schedule, do your billing, but you are your own business at that point. You have the freedom to set your own schedule, take as much time off as you want. So, with the traditional way of working, especially in the employee model, right? Like, I work for a big corporation. Well, the big corporation says you have 2 weeks of the year, and in that 2 weeks time, you have to, take your vacation, get all your continuing education for the year, all the things. Oh yeah, and if you get sick, well, that goes that 2 weeks time too. So, by the time you funnel it down, you're like, holy cow, like, I want to go to a 4-day, class and learn this really cool technique. Well, that's, so much of my time off that, I'm either going to tell my spouse, like, hey, honey, we don't have time to go on a vacation this year because I used it up on continuing education. So that model didn't work. And that model just produces the patient mills. And we just like, man, we can't live in this, because it's just going to kill us in the end. That's not why we got into this profession. We got into this profession to help people, to just really, do a service to the community, and just really help somebody really love their life and do things they really wanted to do. So, when I started talking to Ruth, and she's like, yeah, this is my model. We're like, oh my gosh, this is fantastic. Like, I don't know of any place like this. And, and what she was promoting was a quality practitioner. If you want to go and you want to learn this crazy thing over here, you can do whatever you want, because you're your own business, and we support that, and we're here, and we'll, provide the most of the logistics behind it. So So the draw coming into Prescott was truly to work with Ruth at Backways Physical Therapy and bring our business there. And since we got into town and started working under that model, it allowed me to start going and really expanding my continuing education. And I started getting into this particular type of treatment called visceral manipulation. And visceral manipulation was just a complete game changer in my career, you know. So Ruth, practiced visceral, and she would kind of, take me under her wing and show me all this stuff. And I started going to these classes, and basically visceral manipulation is working with the organs of the body. And you're like, how does that work with pain? And how is that working with clients? And I remember the first class, they were saying, Jean-Pierre Barral, who's the guy who came up with this visceral program, was saying that 80% of musculoskeletal pain originates with problems with the viscera. And I was just thinking to myself, come on, man, 80%? Like, I mean, let's just back it up. Like maybe this guy is completely full of himself, thinks his stuff is just the bee's knees, right? Maybe he doubled it, right? So let's say it's 40%. And I was thinking, even if it was 40%, right? Am I willing as a clinician, a practitioner, to leave on the table 40% of the solution, right? And only have 60% of the results. And if this guy is really truly correct, where 80% is coming from the viscera, that means I'm only having a 20% effectiveness rate with working with my clients if I'm not addressing the viscera. So it, really quickly was just, kind of shook my whole world. Like, once again, how does viscera play in that? If you look at the abdomen, to a physical therapist, they're like, yeah, you have your rectus abdominis, you got your obliques, you got your transverse abdominis. Okay, what else is in there? I don't know. That's it. It's like there's organs in there. And yeah, I remember one of my very first client experiences after going to my very first visceral class, and it was a gal, and she was like, I have shoulder pain. And I'm like, okay, when do you get shoulder pain? And she's like, when I do jumping jacks. And at the time, this is 2014. I'm like, is jumping jacks still a thing? Like I thought that went away in the 80s and 90s, And, no, I do jumping jacks. Okay, well, do some jumping jacks. So she did, did some jumping jacks. And do you have shoulder pain? Yeah, I have shoulder pain. Okay. So I looked at her with the traditional musculoskeletal model of, okay, let me do an orthopedic evaluation on you. And literally I was like, I can find nothing wrong with your shoulder. Like, like I can't find a musculoskeletal answer for you having shoulder pain. I said, if you're okay, I would like to take a look at you this different way. And I said, it's visceral, it's about organs and blah, blah. She's like, yeah, I don't care, whatever. As long as I feel better, I don't care what you do. Right. And so I did that, and I'm like, that's interesting. And with the visceral process, you do the thing, and it's called listening, even though you don't hear anything, right? You just, you have somebody standing there, and you put your hand lightly on top of their body, and you just load into the body. And the crazy thing is, you can actually feel where the body is pulling into. So in a clean system, you put your hand on top of the body, you feel like the feet interacting with the floor. And it's very, very light pressure. So it's not even 5 pounds of pressure that you're putting on there. So number one, you're learning how to interact with the body on a whole new level, right? Like this is nonverbal, right? This isn't somebody that's coming in and saying, hey, my liver is restricted. You put your hand on and it's like pulls over to the liver, and you're like, that's interesting. That's where the liver lives. Let's check that out. So, for her, I did that, and I'm like, sure enough, loads into her liver area. So I worked on the liver and got that freed up. And then I checked it again, and then it pulled kind of into her stomach area. So I'm like, okay, well, let me go over to the stomach area, and started working on that. And I'm like, okay, I did it. Feels pretty good now when I listen to the body. Let's try it out. I'm like, can you do some jumping jacks? She's like, sure. So she did like, a couple jumping jacks. I'm like, do you have any shoulder pain? She's like, no. I'm like, can you do, 10 jumping jacks? So she did 10 jumping jacks. Do you have any shoulder pain? No. okay, how about you just keep doing jumping jacks for a minute? Okay. So go ahead, and I had her do jumping jacks nonstop for an entire minute. I said, do you have any shoulder pain whatsoever? She's like, I don't have any shoulder pain. And I was like, this is crazy. Okay. I'm like, here, let's do this. I'll call you in a week. And if you have no more problems with your shoulders, I'm like, I'll discharge you at that point. She's like, okay. So I called her in a week. I said, how's the shoulder doing? She's like, it's great. I haven't had a problem since I saw you. And I'm like, okay, well, off you go. I'll see you later. And that whole first experience just like completely changed everything because I was, once again, growing up under the, muscle skeletal model, you're just like, so frustrated. And now you have this other tool now, and you're just like, oh my gosh, could you imagine if I had that way back then? You start going through all these scenarios in your head, and you're just like, okay, this is a whole new world. This just opened up for me. So over the next few years, I like took all the visceral classes. I took neuro classes, so working with the central nervous system and peripheral nervous systems. I took the vascular classes, so working with blood vessels. And pretty soon it just like, you start looking at this body and no longer do you see erectus abdominis, so, obliques and transverse abdominis. You see, okay, well, that's the small intestine. That's like the, mesenteric root. There's the gallbladder. There's the liver, so you're in this whole time, this whole shift is happening to you in your career. And as you're working with people, number one, like when we were overseas doing medical mission work, you'd wake up, you eat breakfast, and you get ready to go to your little PT clinic in this hut, in a remote village of Fiji or Vanuatu, and you got a line of 60 people waiting to see you, and you're like, holy cow! Like on my best day, working under the traditional model of being super efficient and working for the man and pumping numbers, like maybe I saw, I don't know, 20 people on my best day, and I got 60 people in line, and you're just like, not only that, I don't speak Fijian, I don't speak Miban, and so it was just amazing to start to see like there is a way that you can actually communicate with this body, and it can be nonverbal. Like you don't even have to tell me what's wrong with you, because don't even speak your language. Like literally, I can put my hand on your body, and your body can be like, "Hey, I need your help over here." So it was just a really really wild ride, to see that whole expanse open up in just different ways. And as we've been here and serving Prescott, certain things happened, and COVID happened, and COVID was just, an absolute ripple effect of just, the world will never be the same, because COVID happened. But in that time, my wife actually had a really bad reaction to the vaccination. And she started having what we now know and realize was vagus nerve problems. And it just, I mean, she would have like horrendous like stomach pains, and she would have like gastroesophageal reflux, so heartburn, and just like all these weird things. Her heart would just start beating like crazy, and we're like, what the heck is going on? And like I said, once again, going back to how we live, how we think, how we got to where we got. I mean, my wife's like, well, I'm not going to take this sitting down, right? Like we're going to find out what's going on with me. What the heck happened, which started leading us down another path, which was doing all kind of vagus nerve manipulation work. And, just seeing how that whole, aspect of care opened up because of that issue that started. And I'm getting clients now that they're coming in and they have these weird symptoms, and no one can explain these symptoms, and you're talking to them and you're like, oh my gosh, like your vagus nerve system is really compromised. What happened? And well, I had COVID, or I had this, and you're in all these things, and you're just like, wow. And you have this tool now that you never had before, and you would have never gotten that tool if you never had time to explore it and have all this time. So coming out of those traditional ways of thinking and out of those traditional models of doing business in the realm of PT, opened up all these just wonderful things. And, the biggest nerve thing opened up. And then we started learning about this autonomic nervous system, and like one thing led to another. And now you find out, like, this autonomic nervous system is like this huge thing that, if you don't treat this in the right way, you're going to be losing out, and I tell my clients, imagine you're sitting in a room and you're reading this wonderful book, and your body is nice and relaxed, and you're just kind of, enjoying yourself, and then someone's coming up behind you and you have no idea that they're there, and then all of a sudden they just scary, and like in a split second, your muscles have a completely different feel to them, with being relaxed and going to a startled, tensed up state. If you walked into a massage therapist, or, another office, and in that state of excitement, and said, I'm having back pain. Oh, well, look how tight you are. We need to stretch you. And, once again, I'm going to look at this problem through that musculoskeletal lens. And they're trying to hammer out these muscle responses, and yet what you forgot is the master controller system that sets the tone of the whole muscle system is the nervous system. So if the nervous system is compromised, right, and once again, thank you COVID, we live in a world where there are just so many stressors in the world affecting us. I mean, how many times your cell phone beeps at you? How many times, oh my gosh, I have to do this. I have to run here. Like, we talk to our friends that have kids, and, it's like, how do you breathe? Like, because I got soccer practice, I got this, I got that, like everything is so spread so thin. And you're like, how is that affecting the nervous system? And the answer is it is affecting it, and it's usually causing people to go into a hypersympathetic state, which the autonomic nervous system has two systems: parasympathetic, which is the rest and digest, and the sympathetic, which is the fight or flight. I'm running for my life. I'm running from a bear, right? And what's happening is we're slowly, kind of coursing towards these hypersympathetic states that we're getting into. Like, we're never coming down off of this alert state, and it's affecting our bodies. So once again, if I look at it in a musculoskeletal way, I'm going to miss something very important, and that is the nervous system. So, having techniques where you can actually manipulate the nervous system is hugely important. And also in this time that we're here in Prescott, and I mean, like, truly, like, blessed with, I have time where I can, if I want to go to a week course, I can go to a week course. Why? Because, I'm my own boss, and I can do that. And I can do that. You know, I, uh, I started getting into dry needling. And why did I get into dry needling? Because once again, my wife was dry needle trained. And I got into a situation once where I actually had some really good body work done on me. And, I remember waking up in the morning, and all of a sudden I was just like, oh, man, like, I just don't feel good. And I started kind of doing some work on myself, and it was just getting worse and worse, as I kept going. And I'm doing like all this, like, oh, I'm gonna do some neuro manipulation on myself. I'm gonna do, I'm gonna check my visceral, like, I'm trying to do all this stuff. And I just made it worse. I mean, I'm like literally getting to a point where I can't think straight, and I'm like, oh my gosh, what is wrong with me? Why am I in so much pain right now? And Lisa's like, what's going on? I'm telling her, and she's like, well, do you want me to do something? I'm like, I don't care. Yeah, just do something. I'm just, losing it here. And she's like, well, let me do some dry needling on you. I'm like, I don't care. You do. And I just remember, like, within 5 minutes time, I went from like a 8 out of 10 pain to a zero. Like, I was literally asleep on the table, when she was doing the dry needling. And, when it was all said and done, I was just like, dang. And she was like, what? And I'm like, now I got to learn dry needling, because this is amazing, like, that you could affect that and get rid of that. And as you're learning the dry needling technique, and they're just like, we are treating the nervous system, this is a way, and we're treating the peripheral nervous system, we're treating the central nervous system, which once again leads to more, and, and I went in and learned dry needling specifically for the pelvis and the pelvis floor. And, we learned some dry needling techniques specifically for the autonomic nervous system. So now we can actually have these people that are all keyed up with these hypersympathetic states. I can dry needle them, and within 25 minutes, they're completely different, autonomic nervous system state walking out the door. You do this technique on people and they're just like, oh my gosh, like, I don't think I've ever felt this relaxed in my entire life. And I'm like, yeah, that's, the nervous system. And if you looked at their muscle tone at that point, it would be wonderful, right? And so, yeah, Prescott has been such a huge blessing for us in our life, because of what was here, because somebody thought outside the box to create a model that produced stellar clinicians, or the potential, right? I mean, you can do whatever you want. It's your business. You can go and you can take every course that you've ever wanted to take, or you don't have to. You can just see the world the same way that if you want to. But we needed that in our lives. We needed these situations. We needed to think outside the box. We needed to get into situations that allowed us the freedom to even, take courses. I mean, I remember when I was going to college, and at the time, like, myofascial release was still like woo woo almost, like, what are you doing? Oh, we're doing myofascial release. What is that? And it was so odd, right? Like these weirdos that do this myofascial release. Do you even believe it? Like we had, conversation. Do you even believe that the myofascial release works, or it is a thing? And nowadays Medicare pays for myofascial release. You're like, these people that, are trying to introduce these concepts, like, as time has gone on, these concepts are not outlandish anymore. So, my wife and I have, I mean, we've been in the practice, we've been PTs for 28 years. So the world was quite different, back last millennial when we graduated, and I mean, you didn't even have access to the crazy stuff that we're doing now, like back then. And, so but what it was is a journey of just discovering, discovering new and interesting ways of looking at the body and looking at the system, and being somebody who could, you know, make a change that nobody else could. I have, like, I really get excited when I work with a client and they're like, man, I've been to several other, PTs in my life, and it could be local, it could be, somewhere else. And they're like, you're nothing like them. And I'm like, thank you. Like, that's the biggest compliment you can give me, because we've worked really hard. We've spent a lot of money, a lot of time to not think and be confined to a musculoskeletal box, and then, when I see my clients, I'm like, hey, I will tell you this. I will look at you through a whole bunch of different lenses. I will try to get to the root cause of why you hurt. I will do my best. I have a pretty expansive toolbox. I got a lot of techniques. You know, let me open it up and let's see what we can find something that's going to work for you, work for your body.
Yeah, that's one of the obstacles I have for explaining you to people that I know is being a physical therapist, because people have a notion of what a physical therapist is. It's pretty
Hmm.
much bands, right?
Yeah.
Band, rotator cuff, kind of like movement based stuff. And I like the other day I was on a hike talking to a guy who's his wife's having some issues and hasn't got it fixed. I was like, you need to go see Justin. He's like, well, you said he's a physical therapist. I'm like, yes, but so I had to explain more in detail, because I'm like, a physical therapist, the way you're thinking, he is not.
Yeah.
But I also don't have a better term for what you are. But then I had to walk through some of the practices that you do,
Yeah.
because I do use you, and I'm going to be seeing you on Tuesday, because I also have some back things I'm going through right now. But in that sense, is like, that's a hard thing to explain. Do you ever run into that obstacle that when you're working with somebody, or somebody that's trying to figure out, should I use you or not, that they just lump you in with the physical therapy idea?
Yeah, absolutely. And, thinking about, like, what has been the difficulty, it's been hard to convey what you do, because, yeah, immediately when you see physical therapy, if anybody's had any experience, I mean, some people have never had an experience with physical therapists, which is actually kind of good, because, they don't have any preconceived ideas, or they don't, yeah, I already tried that. But, yeah, in people's heads, physical therapist is you go in and you meet the physical therapist, they give you exercises, and then you go into the gym or you work with the assistant or the aide, right? And you go and do your thing. So when you're meeting people and they're like, yeah, I have this problem, and and you're like, oh man, yeah, has anybody looked at this? And I'm like, no, like, what are you talking about? So in a way, you kind of get really excited when you start talking to people, but you have to find that kind of balance of like, how do I explain who I am with not overselling it, right? Because let's be honest, I don't fix everybody all the time, right? I don't say that I do, but boy, I sure have a better ability to look at different systems that might be contributory to that person having that pain and discomfort. So yeah, it is hard. Some of my clients have nicknamed me the witch doctor or weird things, right? And when you tell people like, I'm going to put my hand on you and your body's going to show me where it needs, to go, like they have to have enough trust in you, like that you're not full of it, right? You're going to do that and that it's going to actually help them in the end. But I actually think, once again, in Prescott, we're pretty blessed with, we have a really good community of practitioners in this area. I mean, we have really, really good. I mean, there's really good naturopaths in this area. We have good chiropractors in this area. We got, I have a buddy of mine who's an acupuncturist. Like we kind of have a little bit of a community that really supports kind of out of the box thinking a bit. We're not so in a rut in Prescott that they're like, oh my gosh, you're going to do what? I've lived in some communities, mostly in the southeast, where and this is even long before I did the visceral work. I mean, I was just doing kind of traditional osteopathic technique where someone would come in with shoulder pain, and I'm like, oh, I got to adjust your rib because your shoulder blade is rubbing over this rib, and the shoulder blade has the socket and the ball of socket, and it doesn't like rubbing over the rib, so it's going to kind of move over to here, and then as your ball interacts with that socket, it's going to produce pain because of that rib was out, right? And they're like, yeah, I told my doctor what you did, and he said, what is this voodoo? And I'm like, voodoo? Like, does your doctor not understand like how the body's set up? Like, so yeah, so I appreciate that, and like I said, I really appreciate Prescott in the way of and once again, they've had these magnificent clinicians out of Backways, Peter Coppola, Ruth Backway, who started Backways. And, one of the things that they did is they went around to all the doctors and said, give us all the people that aren't getting better everywhere else. Okay. And if we can get them better, and throw us a bone, like, give us. So like this clinic that exists, and was created, was forged out of the most complicated people, right? So like, I remember when I first came here, in 2013, and you know, up to that point, you're working with people, and like you give them the traditional like body maps. Where does it hurt? Put the X on the body, and so you get this body map. You're having shoulder pain, right? Remember some of the body maps I'd get at Backways physical therapy. People were like coloring the whole, and I'm just like, what do I do with this? I mean, is there any part of your body that doesn't hurt? No. And I've been to like 5 other people and they haven't been able to help me. So now I'm yours, you're like, what? So, like you were up against these big things, and you needed better tools, and so, when you talk to people and they're like, what do you do? It's like, well, I'm kind of like a master body worker that uses like really crazy, weird techniques, where I manipulate your organs or your nervous system, to help get you out of pain and get you back to the things that you love. So, I mean, because if you tell them I'm a physical therapist, like I said, then they're kind of, you fit into this box. It's like, well, I'm a master practitioner, body worker who uses all these crazy, wacky, wackadoodle stuff to, make you walk out of there being like, wow, I can actually get back to running, or I can get back to mountain biking, or I can get back to doing this or doing that, playing pickleball. So yeah, it is very tough to explain that to somebody, and like I said, without coming across like like you are to say, you do all this stuff. Like, well, it can do a lot, and, I probably can look at you in a completely different way than someone else has looked at you. So if you've tried PT before, you know, and that's kind of the nice thing too, that's where we fit into this community. We don't necessarily need you to stop going to your normal PT that you're seeing. You might, decide to come to us and just augment that. I do stuff that, I'll be honestly, the majority of the things I do, insurances don't pay for. It's out of pocket services anyway. So, like, if you want to go over here and have your insurance pay for that therapy over there and they're going to treat you in the musculoskeletal realm, great. You do need exercise. You do need to do that stuff. Come see me. Let me work on that nervous system. Let me work on that visceral system. Let me do all these other things that these guys aren't going to do because they can't, because the system wasn't set up for them to do that. The system wasn't set up for them to even look through that lens because they're trying to see you hit productivity marks, and they're trying to take time off and just spend with their family when they take their vacation times because they don't have, you know, 6, 7, 8 weeks, of a year to spend, So we can complement a lot of people. We can, I have, chiropractors that refer clients to me and they're like, do that weird stuff you do, but move their viscera, whatever you want to do, and vice versa, and I'm like, okay, hey, help me out. Like I only have a certain amount of time with people. Like I'll see them, you do this stuff, I'll do my stuff, and we complement each other. So it's very complementary. And, even how my wife and I work are very complementary. She does a lot of neuro work with clients, like people come in and, and they have neuro diseases that are affecting how they move. And she does all these crazy neuro, skills with them. And like, all of a sudden they're like walking smoothly and they don't lose their balance. And you're just like, what the heck is going on? And it's because she's treating them in a completely different way, right? She's treating a whole system and she has a different lens. So, we're very complimentary. I'm like, hey, I'll do my thing. I'll send them over to you and you do your thing. And so, like it's nice because it's not territorial and it's not like back off. Like, that's my client. you know, you're a PT, I'm a PT. Uh-oh, now we're, at odds with each other. No, like, you still need to do all this stuff. And I'm just going to see them in a completely different way. And it would take you, you know, 15, 20 years to know what I know. Like, it's okay. Like, just do your thing and I'll do my thing and we'll serve this community together. And yeah, I kind of like that. I love being a team player in the community rather than a turf war player. Like, that's my turf. You don't go over there.
I do want to point out a couple of the specialty services that you guys do that people probably wouldn't know about. And I want you to like list out kind of the different ones you have, the ones I know of for sure, and then kind of go on
Yeah.
from there. But I know you help people with getting adjusted for the right seat height for mountain biking. I think that's a unique thing. You're working on men's pelvic health, which is a unique thing. Your wife does some stuff with perimenopause or the menopausal cycle too. Just talk about some of the specialty things that you guys do that most people wouldn't know of. Because I think for the average person, they're probably coming to you because they had something go wrong. It's musculature based, but then
Right.
there's these other problems that are unsolvable that they don't even realize there are solutions. And I think those specialty things are probably lesser known that you guys do. And I think just pointing those out would be worth the listener kind of understanding those.
Yeah, absolutely. So as you said, my wife got into mountain biking, and of course, with all things, your wife is always helping you to grow and become the amazing person that you are. She started having pain, and I'm like, oh my gosh, like I want her to be in the sport because I love this sport. I need to, figure this out, which led me into the whole mountain biking fitting aspect. So just learning how to fit a mountain bike so that it works with the body, not against the body, how to get things set up for the person. And then it led me into getting actually certified in mountain bike instructing because I wanted to also know, like, is it her technique, like how she's using this bike? So as I practice as a clinician, I bring that into my practice. So I love seeing mountain bikers. I love, they might come in with knee pain, neck pain, whatever. And the visceral, the neuro might all be part of getting them better. But yeah, doing the bike fits. So we definitely offer that. And I do pre-purchase bike fit. So I measure the body in a way that, as we look at what bike are you looking at buying? And we look at the geometry charts and say, okay, if you get this bike, this size frame would probably work much better than this size frame. And that's really important because the world of mountain biking has changed tremendously. Bike from 2015 is radically different than a bike from 2026. The geometry's all changed. So somebody who was riding a large frame in 2015, they might be riding a medium frame in 2026. So helping them to, get the right frame off the bat saves a ton of money because you don't want to spend $8,000-9,000 on a bike and then decide like, sorry, I can't make this thing fit you, no matter what I do, because you actually bought the wrong frame in the first place. So pre-purchase fits, then we do have the post-purchase fits. So if you already have a bike and you want to feel better on it, be a little more efficient, be more comfortable, I do that service as well. We do dry needling services. So, if people have, looked into things and say, hey, I think maybe dry needling might help me. It's amazing, and I do dry needling specifically for pelvic health in addition to, normal discomfort, pain in the body, and also just health. So you can dry needle the body just to help it actually, do better. So you're normalizing that nervous system once again so that the body has optimal health rather than just getting by health. About So even after taking all my visceral classes, my neuro classes, and using that, and I've always seen, people with pelvic pain, and I actually love working with pelvic pain because it's kind of one of the things that I do really, really well. But about last year, I just really felt like God was just leading me to open up into a different aspect of serving my community. And we do have another practitioner in our clinic, Andrea, who does pelvic health, and mostly women, but she has started to do some men's pelvic health too. But just looking at like what does this community really need, and I really saw a need for men's pelvic health. There's so many. I mean, the retirement population alone. You know, if you look at prostate cancer compared to breast cancer, so breast cancer, 1 in 3 women are going to be affected. Prostate cancer, it's 1 in 2. So it's
Wow.
50%. So, I mean, if you have an aging population and you have, flip a coin, if I'm going to have something wrong with my prostate, where are the services to serve that population? And we were coming up very shy of it in Prescott, and I was just like, okay, I think uh, I think God wants me to kind of start going down to the men's pelvic health, which I got additional training to be able to hang shingle for men's pelvic health, and that's been a huge huge blessing for me. I mean, it's a whole it's a whole different way of interacting with people. Guys are pretty, a lot of them are in the dark about things, and a lot of them are, maybe a little bit fearful of like, okay, what's this going to look like going in? If you look at PT profession in general, it's like, 30, 35 for men in the profession. I'm not even talking about pelvic health. I'm talking about the profession, right? So you got a massively female dominated field, and then you whittle it down to pelvic health, and those numbers get even worse. So men in pelvic health are just like, you don't find them. Like, I went to a class in California for men's pelvic health. I was the only guy there, we're like doing techniques. So, they're like, okay, we're going to palpate the prostate and all this other stuff. And I'm looking around and I'm like, how are we going to do that? Because I'm the only guy that got one. So, I mean, like, it's talk about like, stress and, and pressure there. Yeah, I mean, so we offer men's pelvic health from McKinney Physical Therapy perspective. Backways does have other practitioners. We're actually getting a new practitioner, and she also gets into pelvic health. So we're going to actually have 3 people at our clinic doing pelvic health, which is, I don't think of any other clinic in town that has 3 practitioners doing pelvic health at all, let alone a guy doing men's pelvic health. So yeah, it's been really cool to even offer that service.
So I would say probably 70% of our followers are men. Can you just dive just a little bit more into like what is men's pelvic health? Like what symptoms are you fixing that?
Yeah. So the classic men's pelvic health is you always think of prostate cancer and, post prostatectomies, right? that's just one aspect of men's pelvic health. And if, if you have prostate cancer, by all means, you need to go before surgery. Before surgery. Like, it's not happening. It's not happening in your community. But here's the nice thing. If you're a client and you push your practitioner, your doctor, whatever, and you say, can you please do this for me? Right? They're going to do it. Because number one, no one's got time, right? And they're just going to, oh, fine, whatever you want. I'll just write, what do you want? So, where is this change going to come from? It's actually going to come from the customer, the client, right? So absolutely 100%. If you've been diagnosed with prostate cancer, if that is your future, get into men's pelvic health before surgery. 6 weeks or more would be optimal. Studies have shown if men can get a hold of their pelvic floor and learn the exercises and actually start doing them, the outcome is so much better, so much better. But that's one aspect of men's pelvic health. There's crazy things like Crohn's disease. I mean, there's erectile dysfunction, ED, constipation. I mean, trouble with post-void dribble. You urinate and you're having dribbling issues. Like, pretty much the whole gamut. I mean, I've found hernias on guys. So, it's about the health of the pelvis. Could be pain, could be pain with ejaculation, having sex, anything. There's probably something that can be done to help guys out. I have a buddy of mine who, as I was kind of like, hey man, like, I can treat ED. This is pretty crazy stuff. And he was like, well, just like, if you want somebody who wants to try it out and you want to practice on, I'm willing to, take you up on that service. And I'm like, okay, and so I went through and I did the treatment, and it involves dry needling, right? And it involves, showing them, hip stretches and getting in there and doing some visceral manipulation in the pelvis. And guys are funny too, right? We're a strange creature, because, you're like, hey, how are things going? Oh, yeah, 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 doing pretty good. Yeah. Okay. All right. Anything, I needs to change? No, I think we're going all right. Yeah. And then my wife talked to his wife and she's like, oh my God. She's like, we're like teenagers. She's like, I can't keep up with him. Okay, there's the difference between a man and a woman, right? The guy's like, yeah, good, all set, and it's like, did it help? Oh yeah, but you're talking to a guy, they just always downplay everything. But yeah, so it doesn't have to be scary. And one of our big taglines for men's pelvic health is internal assessments or evaluations are not required. So I can't actually say that I've actually even done one since I've opened up the doors to men's pelvic health, because there's just so many things you do. You don't even need to do that. Even like when you do a digital exam of the prostate, and you say, like, how effective is that in finding prostate cancer? I mean, the studies show, it's maybe 20% effective, so even a digital exam, like, the big one is PSA, really look at those values, look at those numbers. So like I said, I will do things when needed. I've been trained in that. And that was going to that California class where the whole other class, all my classmates are women. And I'm like, this is men's pelvic health. They're all women, so, but yeah, so that's a service, and that's
Well,
kind of what we can do and
I
help.
was saying, I want to say on that one is like, it's awesome that you're doing this as a man, because men, like you said, we're creatures, like, we don't really want to say what's going wrong. So
Yeah.
already saying, not, I don't want to say that something's going wrong in this area. Two, then having a female be the person that's actually doing it, I'm
Yeah.
already embarrassed enough, let alone having that conversation.
Yeah.
So like, that's a huge window for, like, it's an area where more men need to move into for sure.
Yeah.
But just like for your service alone, that's a huge benefit being a guy in there. Cause I could imagine like having those things, like, I'm at the age of 40 where some of those things are going to probably become a little bit more common for me. And I couldn't imagine going to my regular doctor and
Yeah.
talking about that kind of stuff. Right. So I think that's just a huge benefit for our community that we have you here, and, the population of men here, the aging men. I know it's not always just aging men that have those issues, but like aging men that are happening here, it's a huge benefit.
It's a crazy statistic. So ED, we're just talking about ED alone, right? If you're in your 40s, there's a 40% chance you have ED issues, and it goes up 10% a decade. So men in their 50s, once again, flip the coin that you have ED issues. Men in their 60s, now it's the points, a little against you. It's 60%. So men in their 70%, So, these are issues that are affecting men. And like I said, even with prostate cancer, 50-50, like that's awful. You hear about breast, cancer and breast awareness much more than you hear
Oh
about
yeah.
prostate cancer. Like when's the last time you had a march down, the street for prostate cancer awareness, like it's not happening for guys, so
The guys don't say it. When they have it, they don't say it.
guys
That's
need
just,
to,
yeah.
guys need to, honestly, this is a little kick in the pants for every guy watching this, but take responsibility for your health, talk to somebody, don't let things go. The longer you let things go, man, it's not good. If there's pain, there's weird things going on, like, and sometimes guys come in and they're like, hey man, you check this out. I'm like, yeah, like you need to go check that out with your doctor, what I mean? So I could be just that person in, where they just run things by that is, non-threatening, hopefully we keep things light and, and but yeah, one of my jobs is to educate people, and just help them know that, this is really important. This is your health. You don't play with this. You don't want to wait, wait till things get worse. Get the treatment now, and there's really cool stuff out there that really, really helps. So yeah, so there's another service that we offer. Like you said, my wife's doing some really, really cool stuff with neurointegration work and sensory integration stuff where, she's doing some really, really like, you know, you think visceral looks like magic and voodoo, like some of the stuff she does, like do this squat and then she has you do something with your eyes or, your tongue or something. And then all of a sudden you do squat better. And you're like, what the heck is going on? It's crazy stuff. But let's see what else. I mean, out of McKinney Physical Therapy, we kind of have a branch where my wife does brain integration, which is once again more voodoo magic stuff where, people, any ADD, ADHD, anxiety, just trouble concentrating on anything like that. She does a lot of work with that. So yeah, we try to bring to this area services that are, you just never get anywhere else, and it's cool that we have that ability to offer that. Trying to think of what else that I'm missing out here. So we did the mountain biking. I work a lot with long distance athletes. So like people that are doing like the Cocodona 250, Leadville 100, crazy stuff like that. These, ultra athletes. Man, I love working with these guys. They're awesome, and I'm not the athletic trainer of that person. I'm not telling them like, hey, this is your training schedule, right? But I'm working on that body and we're getting rid of weird pains that, that would keep them held back from doing these races and doing performance. So, anybody who wants to just perform better at their sport. And, it could be mountain biking, could be pickleball, could be this, could be that, So we do a lot of wellness. Okay. You don't have to actually have pain to walk through our door. We do a lot of wellness. And I think that's, probably one of the things we do best, like if I have a body and it's already in pain, once again, looking at the nervous system, that nervous system is already keyed up. Those muscles are already tight. You're already, protecting, right? And we have to kind of break through those barriers and in order to kind of, get through the layers and kind of help out. When you come in and you actually don't have any pain, man, the stuff we can get through on those days is unbelievable. It's like you can do 5, 6, 7 systems, and if you came in and you had pain, maybe get through 1 or 2 systems depending on how it is. But
Well, even as like an athlete myself, like the idea of like somebody that's doing performance stuff not having some pain
mm,
is odd, right? Meaning like it's like if you're the amount of stuff as an athlete that you overcome naturally because you just think that's part of the process,
yeah,
right?
yeah,
When the back starts hurting or the knees start hurting or the ankles start hurt, something of that nature hurts. And it's like, well, this is just part of the training. It's just part of the work. And
yeah,
it's like that's one of the things that I've learned over years of doing training and then just doing
hmm
different like from chiropractic work to working with you and that kind of stuff is like a lot of the pains that I'm dealing with are can be eliminated and they're just things that I'm building up by doing the training.
yeah.
And if I want to keep doing the training the way I am, I need to get some work done.
And some people think of pain as a badge of honor. Like I worked out so bad that my back it's killing me for, a week, okay, well, you might need to change the way you think about that. But yeah, I believe that the body wants to be better, wants to not have pain, wants to be in optimal health, right? And once again, I'm talking about, you know, faith and how that comes into, like we pray for our clients, we pray for the day, we pray for everything. Like one of the things that I get excited about is I don't know everything, but I know somebody who made that thing that I'm working on. And if I allow, his spirit to guide me through treatments, like sometimes you're just working with somebody and you get this thought in your head, like, maybe you should try this, right? And you can call it therapist intuition, you could call it whatever. I'm going to go ahead and call it, God, the spirit of God leading me when I work with the client. And, you know, I love that. Like that jazzes me up to just be like, I don't have to have all the answers today. I can lean on somebody who's knows his body much better than me, and I give that person who's coming in a voice, right? Like, tell me what's going on, and I listen to them, and people are really good. They live in their bodies and they're like, man, I think that I got this thing. And they might describe it of like, I don't know, like a farmer, like I feel like this grain of straw is stuck in my side, but man, sometimes they're right on, and you go there and you're like, hey, that thing that you were feeling? Yeah, it's this, so I can tell you the anatomical name and what happened and blah, blah, yeah. But like you just allow that person to come in and you just allow yourself to be kind of guided into how to help them. So with the athlete, a lot of times it's just having conversations with them like, is it okay for you to not have pain? Does that mean you did a good enough workout? Especially like the CrossFitters, like these people are like, they live in pain land. And you talk about people, I mean, like statistically speaking, runners, right? So it's proven like marathon runners, long distance runners, their levels of pain are higher than the normal population. They they do things where they disassociate from their bodies, like why? Because when they're done running and their feet are like these bloody stumps, and you peel them out of their shoes and you're like, what the heck? Like, at what point did you not say like I should have probably stopped here? And they're like, man, I just got in my place and I was somewhere out there. I'm like, dude, like, so yeah. It's funny just working with bodies and with people and how they'll perceive things. But in general, yeah, I would love everybody to be pain free and do wise decisions and treat their bodies. And we're constantly pulling people from out of their bodies back into their bodies and be like, hey, it helps me if you live in your body because you actually are aware of things happening when you live in there. So please don't disassociate and go over here in some other space. So that's one of like Ruth's quotes where we're constantly connecting people back into their bodies.
That's good.
So
I
yeah.
want to take a second to go into your faith a little bit because I know it's a big part of you. And like, first of all, like anybody that's worked with the body in terms of training the body, worked around the body, it's hard for you. I couldn't believe how anybody couldn't believe in God or a creator with
Hmm.
how our bodies function, how everything's interconnected. And like, you think something randomly could make all this stuff function the way it does? So already knowing that, I feel like if you're working with the body, you've got to have some connection with God because once you see it, like, and start working with it and see how things interconnect, me like, there's no way this could randomly happen. But I also want you to dive a little bit into your mission work because you guys have spent
Hmm.
time in different parts of the world. And I think that's a cool thing that, like, yes, you're in Prescott now, but like your journey to get here was really cool too. And I think that's important for listeners to understand that, like, I think your experiences that you've done over time though has allowed you to be as creative in your craft, right? You'd be a technician because if you just go work for a hospital and you become the physical therapist there and you're a physical therapist for that same hospital for 30 years, you
Yeah.
probably don't really have a desire to improve
Hmm.
or need to improve in many ways. But because you've had so many journeys, so many different ways, seeing different things, you have that desire to like, I want to learn more in that by traveling and doing different things. It's continuing to stimulate your brain to be able to do that. I think that's an awesome part of your journey. So I don't want to avoid that.
Yeah. No, one of the reasons why we left this country and started going into different countries was because we felt called into missions. And we looked at different organizations, we looked at Peace Corps, we looked at all kinds of things. And So we started going overseas and getting involved. And, once again, you're in countries where you're bringing in like primary medical or dental, or, you're doing all these, eye surgery clinics, or, you're doing all this really cool stuff. And the same crap follows you wherever you go in the world. And you see like the bureaucratic issues, and like, oh, you're coming into my country, I'm going to make you pay all these taxes to bring on all this free medical supplies and everything. So yeah, it's like, in that process of seeing all this and seeing the frustrations, but you also see the hand of God like rise above all that. And you going into these villages and doing these things. Like I said, got 60 people, trying to wait for you to do PT on them, or you got eye surgeon teams, and you see God show up in a big way, and like barriers that everybody was trying to throw in, and just complicate it and shut things down, and just make the whole thing, when you see those barriers just get solved, and like these crazy miracles, and you start knowing how to live a life of faith, and start learning to expect God to show up, which I think that's probably been a huge part of how I practice today. Like, because of those experiences, I expect God to show up every day. Like when I go to work, I expect amazing things to happen. Why? Because I left space for God to happen, right? And it might look like someone comes in and they're like, "Oh my gosh, like I no longer have that pain, and I've done all this other stuff." And you're just like, "Yes!" And you just get so excited, and you just kind of do a little happy dance for them. And sometimes they come in and they share something just very hard, and they start crying, and there's like, "Can I pray for you right now?" Like, and a lot of hospital systems we worked at past, man, if you want a quick way of getting fired, let them find out you prayed for somebody. I mean, like, that is like one of the big no-nos in the healthcare industry. Like, if you bring God into that situation, you're in big trouble. So another reason why I love, being my own boss and working here, because I get to bring God in, and I get to pray with clients, and I get to, just utilize that gift of God showing up in my treatments. And like I said, and some people, they have no idea I'm a Christian, ever, working on them. And some people, they know it very intimately because we've talked about God, or, had times where, I prayed for them, and that's just a real special thing, right? It's something never to be abused, never to take advantage of somebody in their vulnerability. So, as I approach it very honorably, like, and I always ask him, like, is it okay? Is this okay for me to do this? But yeah, like, if I didn't have God, like, running the show, and, looking back as I was preparing for this interview, just seeing, like I said, that theme, right? Like, no matter what I did, right? There was this theme that I was always going to kind of go this route, right? I was always going to be pulled in the direction that I was pulled in, and learn to think the way I've learned to think, and learn to see the body the way of why? Well, because there's somebody actually who's kind of, orchestrated that whole journey for me, and I've been an active participant, but it's been a really awesome, honoring thing to just look back and be like, wow, God, you took me from this guy that, I mean, I remember my first day at work, fresh out of school, and you're just like, what am I gonna do? Someone's gonna come in, and I'm not gonna know what to do. I mean, like, you take that person, and now 28 years later, and you look at what I can do, and how I can help people out, and it's, if you told me back then what I'd be doing and the stuff that I'd be doing, I'd be like, "There's no way. I don't even believe that that's possible." Right? Like, organs? What are you talking about? Like, that's insane. So yeah, like, you know, it's held our marriage together. It's held our careers together. It's held everything together. God's at the center of everything we do. So, and that is our mission field right now is Prescott, and we want to get back into missions. And my wife is very, very called into international medical missions, and she's brilliant. I mean, she's probably one of the best business organizer. Like she could be CEO of any company because she can just think of things in ways, and she can just tie everything together and just make things happen, and just amazing. So I know eventually, I'll probably be taking some time away from working here in Prescott, where we go and do medical mission trips, and because I know that's, absolutely something that really lights her up and just makes her, absolutely fulfilled. And she loves the internationalness of it, and she's worked in the community in different aspects. But there is that part of us and her that, we definitely will be getting into probably over the next, 5 years, this, looking into that too. So, but yeah.
I mean, that's where I usually go with the legacy start part, and that's what it sounds like you guys are going for. The next stage is like, I know you've talked about you're just starting your 50s, right?
Yep.
So your early 50s, and so you guys are starting to, plan for retirement and trying to figure out what that looks like after this part, which is awesome to be like that. Still, in my opinion, very young to be able to consider those thoughts. Most people are at 65 figuring out how to, can I actually retire now
Yeah.
and go in that next step to be able to figure out what they can do next, where you're early 50s and you're able to start making those decisions. So the future kind of looks for you guys to be like still doing the practicing stuff that you're doing here. Prescott,
Absolutely.
kind of like Prescott will be, the home base, but it's being able to go out and do God's work in different countries.
Yeah, absolutely. I mean, I'm doing what I was made to do. I mean, that's when you can go home at the end of the day and know, like, this is what I was created for. This is the work that, God had planned for me. Yeah, I mean, I'm not going to stop. So even as we look at, like, okay, what does early retirement look like? I'll continue to practice. And like I said, as we look at it for my wife, she'll probably get a little bit more involved with international medical missions. And like I said, as a support, like I will, do what I can with, you know, making that happen. But she's definitely a lot more slanted that way than I am. I'm a little more homebodied in the sense of the worldly travels than she is. She really gets excited about that. So yeah, that's probably in the future. It's a bit of some time off where we're going internationally. Yeah, that's and once again, talking about legacy. I'm part of Ruth's legacy, which when she started Backways and she started this clinic with this model so that clinicians could, rise and be all that they wanted to be. She sold it, and now Andrew Stickle owns it, and he's continued that legacy of her. And my time at Backways is I'm continuing to support that legacy, right? Because that's what we want. That's what we want in Prescott. We want a place where practitioners are coming and have this beautiful opportunity to have a lot of things sorted already for them so that they can really develop their craft and develop into these amazing practitioners that serve this community and does stuff that no one else can do. I mean, it's amazing that we have all this stuff in Prescott, like you don't have to go to Phoenix, you don't have to go to like California, and even California is actually very more restrictive. Like you can't even do dry needling in California as a physical therapist. So yeah, I mean, and that's why one of the reasons why I love Arizona. I mean, we have direct access in the state of Arizona for physical therapy. There's some states you don't. You have to get a doctor's prescription before you even go to a PT. And then everything is, governed by insurance or the whole system that's basically flawed, right? And in Arizona, we have a lot of freedoms. We can do dry needling, we can have direct access, we can do manipulations. We have a lot of freedom in the state, and it's really been a privilege to live here and live in the state and operate under those freedoms that Arizona and Prescott affords me. And I mean, having a business that word of mouth is pretty much the way to go. I mean, that's crazy. I mean, like we don't have big budgets for advertisement, and we got this person tells this person, and pretty soon you're not seeing this person, but you're seeing their wife and their kids. I mean, it's just like, and that's kind of how things spread, and because people care about, that you're doing a really good job, and they just spread it around, which is just amazing. So yeah, it's been really, really awesome being in the Prescott community, and you know, at no point am I gonna chime out. I'm still gonna serve Prescott, and I think that looking at that legacy question of like, what is next, and yeah, we do have to look at that and say, all these things that I've learned and everything, like how does that go forward, right? How does educating the community, how does all that go forward? Is it, videos? Is it programs? Is it this and that? And we have AI coming up, right? And, you talk to some people, AI is the devil, some people it's the savior, right? And the truth is AI will be what it is, and it'll be a tool, right? And it'll help things out. And for the traditional musculoskeletal model, AI will probably actually help that. You'll put your symptoms into the algorithm and it'll spit out like, hey, you should probably do these exercises, right? And it'll probably become a little bit more efficient in the end. But, you know, what is the legacy that we can offer? Like we have to explore that and see like, yeah, how is everything that we learn and everything that, we've been practicing, how can we pass that on other than to keep supporting, backways and that model of turning out excellent clinicians to serve the area. So, I don't know, that's a good question. Needs more reflection.
Yeah, definitely.
Yeah.
So if somebody wanted to get some work with you, coming from like a non-referral based, meaning like not from a doctor or something of that
Yeah.
nature, what's the best way? Just go to your website? Is it email you? What's the best way to get a hold of you guys?
Yeah, everything's funneled through backways. So, the phone number 928-777-8050, that takes you to backways, and McKinney Physical Therapy is at backways. McKinney Physical Therapy has our own website where you can read up on all the services we offer. The biggest nerve work, mountain bike, fitting, visceral work, men's pelvic health, all that. And that's Prescott PT.com. So Prescott Physical Therapy, right? But PT.com. So, they can look at stuff. And like I said, we live in a state with direct access. So if you're coming in and, you aren't expecting, insurance to pay for it, you come right in, right? So you don't need a doctor's referral. You just, call in and get an appointment. People that have Medicare, right? They have the entanglements of Medicare, which is basically you have to have a referral. You can't, and they're not going to pay for dry needling services. They're not going to pay for visceral. They're not going to pay for vascular work. They're not going to pay for central nervous system work, right? So, and that's part of the reason why I just shy away from a lot of Medicare clientele is because, you're like, I could do a lot with you, but it's not even covered. So if you want that, it's going to be self pay, and it's a lot easier if people are coming in not within the regards of like, hey, is my insurance pay for this? We're kind of like a niche PT service, right? I mean, we're kind of like a bit of a boutique thing, and we offer things that you're not going to get anywhere else. So it's really hard for the system, like I said, that's set up that use life in musculoskeletal terms and promotes efficiency and turning clients out, right? Like that, those systems aren't going to serve your best interest. And, so we do a lot of just self-pay clientele, and that takes the handcuffs off me. I do anything I want with them, right? Go anywhere I want and treat whatever I want. They come in one day, I got a headache. They come in the next day, I got foot pain. Like it doesn't matter. Like we treat the whole body. So it's a lot better, a lot nicer way. And when I see a client, I'm usually like, kind of like about a month or maybe 4 or 5 sessions to get through the heavy lifting of the dysfunction, and at that point it's spread out. It's like once every 2, once every 3, once a month. And I got some clients that I see once a month, some I see once every 3 months. And then we just touch base, and like I said, it's kind of like more of a holistic health model rather than fixing people up from this unbelievable pain that they're in model, and then as soon as they get out of that, then off they go. So, I watched the podcast with Kai, and he got how he's like, yeah, there's kind of that initial month where we really see the client, and then we kind of start spreading it out, and as the body is, holding, and we start spreading it out. And that's kind of what, same thing, so we're very, very similar with our approach to the body, as far as like the body should be doing better. It should be able to go longer periods of time without having to come in and do such heavy lifting work. So usually the first, like I said, usually the first, 4 or 5 sessions are highly intensive, and then after that, it kind of spreads out and it gets, better and better. And then, like I said, whatever the person's goals are, some people, they just want to be the healthiest they can, and do whatever they want and not have any issues pop up later. That's a great client. That's a wonderful client. We can have to do a lot of work on that. But some people that are like, I only want to get out of this pain. That's it. Okay, all right, we can do that too. But yeah, I like clients that are a little bit more invested in their health, and looking at a little bit more long term, like, how what are some steps that I can do just to stay healthy, and keep all these wonderful results. How can we start planning on that? So
Awesome.
yeah.
All right, guys. Thanks for joining us on this episode of the Brotherhood Beyond Business podcast. All the information about Justin's business will be down below in the YouTube descriptions. Otherwise, on our website as well. You can link off to his stuff. Otherwise, just go to his information at McKinney Physical Therapy, or it was Prescott,
Prescott PT.
PrescottPT.com. All right, talk to you guys later. Hit subscribe, turn on notifications, and stay locked in. Brotherhood is more than business. It's about leading from the front, leveling up in every domain, and becoming the CEO of your own life. Step up, execute, and we'll see you in the next one.